Isang mapagpalayang araw laban sa droga. Ako po si SANTIAGO, Provincial Officer ng PDEA ABRA. Pag-usapan natin ngayon ang tungkol sa drugs. Very interesting. Ngayon, ano ba ang common reasons for drug involvement, lalong-lalo na sa mga bata? Number 1, personal problems. Number 2, peer pressure. Sabi nila, isa pa ay it just feels good. Masarap sa pakiramdam. Number 4 is curiosity and experimentation. Escape from reality at iba pa. Ngayon, ano ang drugs? Ang drugs ay any substance that prevents or cures diseases or enhances physical or mental welfare. Any chemical agents that alters the biochemical or physiological processes of tissues or organisms. May dalawang klase ng drugs. Ito ay legal drugs. Ito ang mga prescribed and OTC or over-the-counter drugs. Illegal drugs. Ito yung mga psychoactive substances. Ano ang psychoactive substances? Substances that modifies a person's perception, mood, cognition, behavior, or motor functions. Ano naman ang substance abuse? The harmful use of psychoactive substances including alcohol and other drugs. Sabi ng maraming eksperto, the sustained use of psychoactive substance can lead to dependence syndrome or ito ang addiction. A cluster of behavioral, cognitive, and physiological phenomena. Dapat maintindihan natin ang drug dependency. Ano ba ito? Typically characterized by a strong desire to consume drugs, difficulty controlling its use, persistent use despite detrimental effects, preference to use drugs than to other activities, increasing tolerance to the drug use. Addiction is progressive. Without intervention or treatment, it can cause disability or even death. Common signs of use. Ito yung mga nakikita natin o mapapansin natin sa mga bata na nakagamit na ng illegal na droga. Number 1, changes in attendance in school or work, abrupt changes in overall attitude, irritable, discourteous, aggressive, usually untrustworthy and lack of self-confidence, low frustration tolerance, lacking interest in one's study or work, blames everybody but oneself, prefer to stay with peers, may frequent odd places, poor physical appearance, wearing of sunglasses at inappropriate times, unusual effort to cover arms to hide needle marks. Ito nakikita natin sa mga international na arena. Dagdag pa rito, yung stealing items which can be readily sold, unusual borrowing of money from relatives and friends, association with the known drug abuses. Ito, ang drugs ay nakakapekto unang-una sa person, sa family, sa community, and also the society. Ano ang epekto niya? Effects on the person: medical and physical deterioration, respiratory, digestive, and other health problems. Dito na naglalabasan lahat ang mga sakit. Personal deterioration, manipulativeness, negative attitudes, selfishness, low frustration tolerance, poor family relation, non-trustworthiness, depression, absence of good manners, and right conduct. Kasama dyan ang mental deterioration, loss of interest to productivity, emotional immaturity, no initiative for self-improvement, inability to concentrate, psychosis. At panglima ay ang spiritual deterioration. Drug abusers are godless, no spiritual beliefs, no spiritual obligation, nor religious responsibilities. Epekto naman sa pamilya. Family members develop intense feeling of humiliation and guilt. Low self-esteem of family members. Spirit of togetherness and unity are broken. Domestic violence. Loss of money or valuables. Epekto sa community. Increase in petty crimes within neighborhoods. Increase of drug dependence and drug pushers. Developing fears of drug users among residents, especially at night. Neighborhood association and interaction is reduced. Ano naman ang epekto sa society? Increase in heinous and antisocial crimes, overwhelming fear towards drug dependence, limiting people's movement, especially at night, disregarding of moral values and deterioration of the moral fibers of the society, leading to prostitution, pedophilia, child abuse, and other immoral acts. A threat to national security. Myths and misconception. All illegal drugs are dangerous and can cause physical and psychological changes to the users. Prolonged drug use worsens the harmful effects. Prescription drugs should always be administered and used only at the direction of a physician. Marijuana is no worse than using alcohol or tobacco. Alcohol leaves the body within 24 hours. It is water soluble. Marijuana is fat soluble. It attaches to fatty parts of the body, usually the brain and reproductive organs, and can be detected up to 30 days after initial use. Ito ang mga epekto or risk factors. School, social, and family, and other factors. I-discuss ngayon natin isa-isa. Risk factors sa family. Drug use and criminal behaviors. Drug use in the family is a factor associated with the initiation and frequency of drug abuse by children. Poor and inconsistent family management practices. Children in family with low disciplinary practices and interaction with parents are at high risk for delinquency and drug abuse. Family conflict. Children raised in family with a high rate of conflict at risk for delinquency and drug use. Homes broken by marital discord are at higher risk of delinquency and drug use. Family social deprivation. Children living in families characterized by social isolation and multiple entrapments of parents in extreme poverty are at elevated risk of drug use. Factor naman with regards to social. Early exposure and frequency of antisocial behaviors. Early antisocial behaviors in the primary grades predicts frequent use of drugs in adolescence. Delinquent behavior may lead to drug addiction later in adolescence. Attitudes and beliefs. Individuals with values different from those dominant in society are likely to become delinquent and drug abusers. These values includes low religiosity, rebelliousness, high tolerance of deviance, resistance to authority, a strong need for independence. Attitudes and beliefs. Knowledge about health effects has a preventive effect on drug use. Positive beliefs and attitude towards use of drugs, alcohol, and tobacco leads to use of these vices. Pressure and other factors. Drug behaviors and drug-related attitudes of peers are among the strongest and most potent predictors of drug involvement. School failures. Delinquency is related to academic performance in school. School failures in elementary grades precedes delinquency. Poor school performance is a common antecedent into drugs. Low degree of commitment to education and attachment to school. Those who are committed to participating in school activities, holds high achievement and education aspirations are the least prone to delinquency and drug abuse. Drug users are more likely to be absent from school, cut classes, and to perform more poorly than non-users. Neighborhood attachment and community disorganization. High population densities, high crime rates, and lack of natural surveillance in public places can cause increased delinquency and drug abuse. Similar to crime rates, community values norms also affects rates of adolescent delinquency and drug abuse. Mobility. Increased antisocial behavior results when experiencing transition, transferring schools or moving between levels. Residential mobility can also predict delinquency and is also related with drug initiation and frequency of use. Constitutional, genetic, and personality factors. Children with biological or psychological deficiencies are at greater risk of abusing drugs. Those displaying abnormal mood, anxiety, or behavior disorder are at risk. Those are clinically depressive, displays anxiety disorders, or impulse control disorder are vulnerable to substance abuse. Media. Advertising is powerful in influencing youth's decisions. Film and TV stars, pop stars, and fashion models make smoking seems attractive and that adolescents imitate them to smoke their style. Pag-usapan naman ngayon natin is yung mga commonly abused substance. Marijuana. Other terms, grass, pot, reefer, and weed. Paano siya ginagamit? Usually smoke, bake into brownies, brewed like tea. Effects on the body. Anong epekto niya? Marijuana impairs memory, concentration, perception, and movement. Other terms, tatawag sa kanya, crack, blow, snow, or coke. How it is used? Snorted, smoked, or injected. Epekto sa katawan, causes dizziness, headaches, stimulates the brain and spinal cord, and increased heart rate, elevated blood pressure, increased body temperature, increased breathing rate. Ecstasy, other term, X, Molly, happy drug, love drug. How it is used? Orally in pill form. Effects on the body, increased heart rate, blood pressure and body temperature, dehydration, nausea, muscle cramping, involuntary teeth clenching, blurred vision, chills, and sweating. Shabu. Other terms, shabs, S or bato. How it is used? Is snorted. Effects on the body, tachycardia, hypertension, atrial and ventricular arrhythmia, chest pain, dyspnea, edema, abscess, cellulitis, seizures, hypotension, dental caries. Pumunta naman tayo sa kung paano natin maiiwasan ang drug use. Number 1, understand how alcohol and drug addiction develops. Get help. If you have an alcohol or drug problems, avoid temptation and peer pressure. Find support that you need. Maintain physical wellness and mental health. Use drug properly. Accept yourself. Develop your potentials and engage in productive and fulfilling activities. Communicate your issues and concerns. Learn how to cope with your problems. Seek professional help if you feel you cannot cope with problems. Develop strong moral and spiritual foundation. Itong mga to ay ang mga kailangan natin malaman para natin maiwasan ang illegal drugs abuse. Dapat mas matibay ang ating moral fiber sa pamamagitan ng pagpupunta sa mga simbahan o iba't ibang klaseng mga reliyon para mas maging matibay ang pundasyon ng bata at mga magulang na nag-guide sa kanila. Sa lahat ng iyon, kami po ay nagpapasalamat sa pag-imbita sa amin para mag-conduct ng short lecture tungkol sa illegal na droga at kung paano makaiwas. Maraming salamat mula sa PDEA ABRA Provincial Office. Thank you very much and God bless.